Welcome to Like Minded with Dr. Patrice. Each episode, we'll be sitting down with different types of experts and unpacking the intersection of mental health, pop culture, and our day to day lives. My name is Dr. Patrice Lagoy. I am an international psychologist and a licensed marriage and family therapist. I'm also a former entertainment executive. In this episode, we will be discussing mental health for child performers and athletes, what pressures they might be affected by, and how parents can best support their children participating in sports or the arts. My guest today is Dr. Patricia Perez. I'm so happy to have her with us. Dr. Perez is a global consultant, speaker, psychotherapist, and researcher. She is also an adjunct faculty member in the Department of Psychology at Adler University in Chicago. She received her Master's of Education degree in Child Development and Infant Studies from the Erickson Institute and her PhD in Counseling, Psychology, and Multicultural Counseling from Loyola University, Chicago. Dr. Perez has taught child development and psychology courses across 7 higher education institutions for over 27 years. She's a subject matter expert in child abuse and neglect, children with special needs, global trauma, child development, third culture kids and adults, life coaching, and international education. Welcome, Dr. Perez. Thank you so much for joining us.
Thank you so much, Dr. Lagoy. It's been a pleasure.
Thank you. So we have really seen a lot of examples lately of athletes and performers coming forward to share their mental health challenges amid the pressure of excelling. So, Simone Biles, Naomi Osaka, Lewis Hamilton, they've all shared that they have experienced anxiety and depression and often noted that this started when they were young. So what kind of pressures do you see children involved in performing or athletics face specifically?
Yeah, that's such a great question and just so timely in the world of psychology and just really in arts and entertainment. So I would say there's several things. I mean, obviously there are just so many things, but I think number one, pressure is the expectation of the industry in adults. So I mean, I could go more into that, but that's number one. Number two is social media. You can only imagine this generation, the generation of social media, the comments on social media, just anything related to social media is number two. And then really from a psychology lens and developmental lens, the third pressure, I would say big pressure, is that idea of am I good enough? And my identity could be wrapped up in whatever art form, whatever athletic form there is, and how do you reconcile that with yourself and also how it looks like out in the outside world. So those are 3 really big dominant, I would say, pressures. There's just so much more to unpack with each one of those, but
yeah, let's dig into each
huge.
one of those. Mm-hmm. Yeah,
Okay, yeah.
Let's talk about the pressure from the adults that the children might face. Mm-hmm. I think that's really important to discuss.
Well, let's just say, to be, again, honest in this space, that it's a business, right? Yes. Arts and entertainment, whether you're a child, whether you're an adult, it's a business. So when I'm saying expectations, part of the strategy, part of the booking, part of the understanding is that it's a business. You want people to watch, you want people to follow, you want people to do all these things. And if you're a child, we're defining children, right, as under 18 years of age. If we're defining a child, there's that disconnect between, okay, I want to please, and we know this in psychology and child development, that many children, maybe not teenagers, because they're going from a transition from being a child to an adult, so they have the more of an adult thinking mind for typically developing children, but children want to please adults. So they want to please adults, they want to belong, right, and they want to do well. And so sometimes there's a disconnect between, okay, how much do I want to voice and say, okay, I've had enough, but the adults in the industry, because it's a business, because we want more, because we want to be perfect, we want to do all of these things, that they push themselves and they're not maybe privy or understanding that maybe that more really shouldn't be more. It should be a time to rest. It's a time to rest, which then hits, as you can imagine, mental health. So those are the pressures, as far as, right, the pressures as far as the pleasing. So in social psychology, I don't know if you've heard of this term, I'm sure you have, birds of the same feather flock together. So they're in a family, right? They're in a family. Parents probably say, okay, sign a contract, do all these things, or maybe you're in elite travel basketball or something like that, and then they become another family for everybody.
Yes.
But again, we want wins, we want Oscars, we want Emmys, we want all of these accolades for validation, but sometimes part of that validation and really true optimal performance doesn't happen with the expectations of adult versus how a child is actually developing.
Absolutely.
And that really plays in, right? That really plays in with that mental health.
Yeah, and I think too, when we're talking about the pressure, kids likely don't have the language. And in addition to having the language to say, I need a break, you also need to have an adult who's willing to listen to that and to give you that break, right? And I think with the pressures, you see sometimes in child performers, and, we've seen a lot of exposés on this kind of thing. Often, the family's depending on that child to make a living for all of them. So that adds to the pressures. I can't let you take a break now. Like we need this.
Yeah, I wasn't going to bring that up. Yeah, I wasn't going to bring that up, but that's another huge piece, that there are, again, basic needs that need to be fulfilled. Like if this child just does not get the gig, if this child does not get noticed by a scout for then upward mobility, this has a huge impact on the family system. And it's not even only that, right? The basic needs. It's also that this child has been put up potentially on a pedestal for their talent. And that is what gets rewarded. Okay, that's what gets rewarded. And that's all wrapped up in the expectation of this like potential golden child for either emotional, financial, right? Like well-being for the entire system, especially, when we're talking about, because I do work too in the, in the community and belonging and inclusion space, where like collectivistic families that hold true, like you do things, you as a child, right, as a representative of our collective family, do things because this is what is good for the whole family, as opposed to what's good for just me.
That's right.
Right? That could be very perceived as very selfish. So there's so many layers on that, and especially like family systems that are very top down, where the parents or whoever's raising you calls the shots.
Yes.
So if they call the shots, then you're going to be following the shots, right? Whether or not you have a voice, whether or not, and that could start really early with those patterns of behavior.
You know that you have to do what your parents tell you to do, even if you're injured or, you're not in the brain space to memorize those lines or any of those kinds of things. I think that's true. The cultural part of it is so important because the kids know what their role is. And ironically, Dr. Perez, they're also being put in an adult position to provide, so you don't have the power to say, this is what I need, but you are expected to perform as an adult would, to put aside whatever's bothering you, to put aside any challenges and perform because that's needed. I mean, what do you think about that dichotomy? That must be such a struggle for kids.
That's really hard because, again, it's very contextual, and this because both of you and I are both international psychologists, Dr. Lagoy, that it really all depends on the context. So we do know it's not even arts and entertainment or child performers or athletes. Like in other parts of the world, they have adult roles. They're either taking care of the younger siblings, or maybe they're making the money, they're working in a factory, or they're going out into the streets, or maybe they're an affluent family and the hierarchy says this is what you need to do. You're going to be covering the family business. But when it comes to performing, and you are really beholden to the adult expectation of the business, of the role, and even probably your team. So like a movie, if you're part of that, if the adults around there aren't aware of their own emotions, aren't aware of their own expectations, they potentially, because they've been prepped and conditioned, take on that role, right? They take on that role of taking care of everybody else. So not only are they taking care of everybody in the family for potentially those basic needs and finances, they're also taking on the emotional role, and they may really be good at what they do. They may be good at soccer. They may be good at, even the home games. Their parents are proud of them, but at the same time, right, where is the child, right? So the norm is they live life as a child, right, during under 18 years of age, whatever that means in the context, where they go to school, like typically, right, they go to school, they make friends, they go through all those milestones. Maybe here in the Western world, they get their driver's license, they have their first boyfriend, girlfriend, like all of those things, but none of those things could be happening on set, for example. Right? None of this is happening. Or like, if they have to have a certain diet, they can't go out for pizza party night with their friends because they're not allowed to eat carbs.
Right. So or they have an early morning shoot, and so they can't, they can't go to prom. Yes. They can't do this or that.
Yeah.
Like, I think that's it's such a good point, that we maybe sometimes don't pay as much attention to, because kids who are, doing well at their sport or doing well performing, they can also be like, well, they have it all, they must be happy, right? But developmentally, we need to have those experiences to socialize with other people, the opportunities to fail and to rebuild, to lose relationships, to build relationships. And all of that can, depending on the situation, kind of be taken away from the child. So, you may grow up, but you miss out on all these opportunities to grow and develop.
Yes, and sometimes what happens, Dr. Lagoy, is that because they don't have those opportunities during these what we call developmental periods, where certain developmental milestones, like things that typically happen at this age, right? Like early childhood, which is 2 to 6, middle childhood, that's 6 to 11. The adolescent years is now like 20 to 40, right? If those milestones don't happen, what happens is that they revisit this when they're adults.
Yes.
Right? And sometimes that could be really detrimental, because it's like, then the perceptions are, you're really immature. Like, you didn't know this, you didn't know, and then that makes you even more different. Not only are you maybe physically, I don't know, in elementary school or looking like your elementary school, but you have this extra talent. And I think people, whether they're children, whether they're adults, look at you, they think this person has it all. I think that's what happens when you're in the spotlight. Like this, whether it's a local spotlight, local community, or you're hailed to be like the prom queen, or you're actually in a global movie, or you're in theater, Broadway, all of those type of things, that people looking at you go, oh my gosh, that family must be so proud. That child must be just so excellent in all of the other developmental areas, like physical, motor, cognitive, like they're so well adjusted. But what we find in research, actually, that when kids are further apart from what the norm is, there's a lot of disconnect. There's a lot of wondering, like, so it's not surprising that many of these kids put that pressure on themselves, because they look at their peers, and maybe it is exciting that they're going to be co-starring with somebody in a movie. But that's our perception, because we're not co-starring, right? We're not the ones co-starring, and that seems like a fantasy to us, but for them, that's their norm.
It's their job.
And so, right, that's their norm. And so what's hard about that is that for some of these actors, performers, musicians, dancers, athletes, sometimes the craving is like, you know what? I just want to go unnoticed. I just want to live a normal life. I want to go out with my friends, if they even have friends that are true.
That's right.
To them. I mean, that's another pressure. Like, who are your friends? Which is another social, emotional, developmental milestone, to be able to not feel isolated. But some of these kids can't feel very isolated, because it's like a club. Who else is in this club? So you can see. Like, I grew up with Mickey Mouse, okay? I don't know if you know that, but like the Mickey Mouse Club, like all of them became friends because they had the same lived experiences growing up in the spotlight and on camera, as opposed to like having a friend who has no idea what you've been doing,
right?
And
so difficult
doesn't
for other
understand
people
that.
to relate. Absolutely,
Right.
it's so difficult for other people to relate. And you mentioned earlier, which I think is important. I think we can all think of examples of people who have grown up in the spotlight, and now you see them as adults, and you're kind of like, something's like they don't seem to be doing well. What is that? And it's that talking about where the growth, the development gets stunted when you are not able to go through these developmental stages in a more normal fashion, right? That sometimes you can get stunted at a certain age, and now as an adult, it doesn't seem to match up the way people's age, their biological age, and their behavior doesn't always match up. And I think there's a lot of examples, in pop culture that we can think of with that. I want to the second thing you mentioned, which I think is so important because it's also not something that has always been around. There's always been kids who have been performers and kids who have been athletes, but there hasn't always been the social media pressure. So could you talk about that, Dr. Perez, about the layer that adds to the conversation?
Yeah, well, social media, I would say, I mean, not all social media is bad. I think it really has brought our world closer to each other. We can find connection to people we've not had connection before. I think, and there's a lot, there's a lot of these type of things. The American Psychological Association has actually healthy tips for healthy usage and a health advisory for social media and children. So I think that's a great resource to take a look at that through the American Psychological Association website, which is apa.org, where it's really intent. Okay, it's intent, frequency, like how much time do you spend on social media, and how, we all have individual differences, and teenagers really, like the 10 to 14, right, 14 to like young adults are the ones that use it the most, because they're the ones who know how to use, obviously a 2 or 3 year old, if they were using social media, that would be really, that would not be appropriate. Yeah. But middle school, teen years, when they use social media, it's duration, like how much do they obsess over this, and then so the impact of that on mental health is that you're reeling, you're scanning, you're looking at all of it like obsessively, like every second of the day, right? Every second of the day. And if you're not on a shoot, you're not, on the field, you're not doing all these things. Some of these stars are people who really are, maybe even unconsciously looking for validation or want to see whether they belong or they're doing well, right? Because they want to have a good persona. Look at these things, right? So how do you cut down on looking at this and also realize whatever you do, and this isn't just for child performers and athletes, whatever you do is other people's perception of you. It's maybe not you, but however, children internalize it and maybe don't have the wherewithal to say, okay, I just saw a comment on my Instagram, and that's not me. But we all freak out. Again, a lot of people freak out over these things, and then it leads to like rumination, and we're ruminating over it. We overthink it. We wonder, maybe we track that person's handles. Who is this person?
Why are they saying that about me? Yes.
Yeah, why are they saying this? They don't know who I am. And then that can consume us.
Absolutely.
With that consumption, then it distracts us. Right? It distracts children from doing what they need to do. So they may not be able to learn their lines. They may be so shut down over something like this, in addition to if they have, in the arts in particular, have performers, and it's not unusual for diagnoses like depression and anxiety to be prevalent, or being neurodivergent, right? So all of those things, because we are very creative, we're all very innovative, we think in different ways, visual, spatial. But when we have words like that don't fit who we think we are, it can, one comment, it can rock your world.
Absolutely. So, and the challenge also, of course, is that it may be part of these kids' jobs in some way to be on social media, in some ways, right?
Correct.
And so it's really important to have those boundaries around that. And they're not at the age, the developmental age, where they can say, this person doesn't know me. It doesn't matter to me that they said this about me, because your whole job is validation, right? You can be a great soccer player, but someone needs to see you be a great soccer player. You need to get discovered, right? You can be a great dancer, but you need to have an audience, right? As part of your job, if this is what, you've chosen to do, or your family has chosen for you to do. And so that validation, that expecting the validation from strangers often, is probably so ingrained in kids. And when you don't get that, then that hurts probably even more. And I think it hurts kids who are not in the arts, who are not performers, because of that developmental that age where they are, where they're it's difficult to separate themselves from what other people say about them. They're still learning who they are, right? And
right, but
to have
it's
to do
okay
that on a public stage, is very
but
challenging.
it's okay. There are definitely protective factors on that. I think even this question that you asked, Dr. Lagoy, would be helpful for like child wranglers, producers, just anyone who brings on a family and a child. Let's just talk about like the arts, bring in any of those capacities, where they have this process about, okay, let's talk about the social media usage.
Yes.
You also, for example, need to have a following. But at the same time, I think the preventative factors is that, okay, whatever they post, like concrete stuff, whatever people comment or whatever is not you. We know you're good. Okay, it's very similar, and we'll maybe talk about this later, but it's almost like a side-by-side to what we call positive parenting, where you create a supportive, loving environment. And you could do this in a athletic team. You could do this, right? You could on set. You could do this with a family, but everyone has the same sort of communication that whatever you do, whether it's a mistake or you get feedback on social media or whatever those parameters and rules are, that you are still loved, right? You are met with kindness, and there is warmth to that.
Yes. So
that needs to be consistent, because this is a very unique niche for kids. And some kids, whether they're required to do this or not, might want to do it, whether it's something that's chosen or they're good at it. And sometimes just being good at it already fuels them to be there. But when it does come to social media, it's no surprise that many people in many industries want a following, right, for whatever the reason is, as the business, and also to showcase their talent. But I think talking about some of those preventive factors and strategies, and going back then to say, okay, now what do I do? And having that supportive team, whether it's a point person, whether it's the manager, right, whether they're execs, but they know if their parent is not there, they can go to this one person and go, okay, this just happened. So they don't feel alone. Okay, they don't feel alone in this entire journey.
Yes. Well, and I think, I'd love for you to talk a little bit more about the positive parenting, because this discussion obviously is specific to child performers and athletes, but it has broader implications. Everyone who has a kid who's parenting a person, can benefit from some of these kinds of like different ways of having conversations, or just more openness around some of these difficult subjects. So if you could talk a little bit about that, Dr. Perez, that'd be really helpful.
Yeah, so I mean, I could, I teach child development classes. I'm currently teaching an introduction to human development class, and we talked about sort of the historical context of parenting. And as you can imagine, all communities, all family systems have their own, like, this was how I was raised, and this is my way or no way. However, in this generation, and what we find is this notion of positive parenting. Okay, that's what it's called. Positive parenting. If you take a look at like the Center for Disease Control, they actually have positive parenting tips across all of the ages. So from 0 to 18 years of age. And so what is positive parenting in a nutshell? It is the idea, right, to provide love and supporting, like, and kindness, and to create that type of environment. It is not something like we don't discipline them or things like that. But so it's number one, creating loving warmth in that type of environment that is consistent, that's predictable, because then it breeds safety and security. And once kids feel that on a consistent basis and on all levels, family, sets, community, all of these levels, like the systems, then that will actually go into optimal performance. And that's what we want. I mean, with any child, they're reaching their potential. Like any child, whether they're, they're high-end athletes at some point, they're being signed for college or any of those type of things. So that's number one. Number two is a strength-based approach. So what we find sometimes parents do is that they look at all the negatives, or just everyone, like what you didn't do.
Yes.
So they're building
their kids' resilience by doing that, or like pointing out the things that didn't go well, right? Like
why didn't you do this? Why didn't you get the gig? Why didn't you try hard enough and run hard enough? Because then this could have happened or this couldn't happen. Well, that really speaks more to the parent or the adult who's saying all these things rather than the ability of the child. Yes. So the second part of positive parenting is the idea of what they can do. Rather than you're starting from that framework. What can this child do? And start with the strengths, because you can use that template in all their strengths to then level up to things that they need to work on, which is their areas of growth. Okay? So for example, if a child is really creative with music and you're trying to have them learn their ABCs or learn math, you could potentially, right, someone who's attuned verbally and non-verbally and from a sensory point of view can then have that adult be attuned to that. Then they can use music, for example, to help them understand, right, its relatedness and alignment, have them understand then concepts of multiplication, concepts of, right, all of those type of things then. So that's the second big point. So loving, warmth, supportive environment, okay, and that all depends, right? So not punishing and threatening and I'm going to withdraw and take things away from you necessarily, number one, and then strength based. And then there's a whole bunch of other things, strategies of how to actually do that.
Well, I think, what you're saying, it makes me think of how when there are challenges, that performers or athletes face and they say, oh, I was the victim of abuse for all these years or that kind of thing. And people say, well, why didn't you say anything? But I think you're really laying out the reasons that people don't speak up, right? I didn't feel safe. Everyone was counting on me. I knew that
Correct.
people could not hear this or would not be able to tolerate that. And when you talk about positive parenting and building up those strengths from the beginning and people knowing that they are loved and not because of what they can do, but because of who they are, right? All of those kinds of things, that creates an environment where maybe kids are willing to say, this felt wrong. This didn't feel good to me, and they know that there is an adult who will listen to that, right? Rather than knowing, I better keep this to myself because no one has the space for this. No one wants to hear this, or they might stop loving me or caring about me if I tell them that I don't want to do this anymore, right? And I think it has such repercussions to build that kind of relationship with all of our children, and also especially with children who might be exposed to adults in different scenarios where there may be opportunities to exploit children, building that kind of resilience and that kind of security within children it's so important, Dr. Perez.
Yeah, so it's not just security for themselves, but over time as they transition from a child to an adult, they then have the strength because it's become a pattern of behavior. They're like, you know what? No, I'm not doing this, and they're not waiting until adulthood to say no. And that's a whole nother skill set, right? That's a whole nother skill set because it's messaging. So for parents, sometimes, with our busy lives, we're exhausted. We're like, okay, we're just going to let this slide or whatever. But you don't understand that every single day is an opportunity for teaching, modeling, and guiding.
Yes.
Right? And like using ourselves as a model. But also it's messaging. So like, for example, whatever we say, whatever we do, it's verbal and nonverbal. Because you could say one thing, but your face and your whole body, right, says something else, and it doesn't match, right? It doesn't match at all. And so what's interesting here is that we want to give a message consistently and predictably that you are loved, you are good, no matter what, right? You are loved, right? Obviously, they're going to make mistakes, but you're going to do it in a way, right? So they go, I really want to talk to you about this. This is something that was not appropriate for you, Sally. And let's talk about that. And you have a conversation. Yes. And for some parents, they got, I love you and care about you and appreciate your efforts. This provides. So some of the strategies for positive parenting is as I mentioned, teaching, guiding, and mentoring, but it's also you're being respectful to the child.
Yes.
Gone are the days, right? Gone are the days where a child is like a child and they're like inferior to you.
Mm-hmm. Seen and not heard, yes.
We look at a child with respect. Obviously, you've lived here long enough on this earth as an adult, longer than they have, and so they look up to you. So, but when you address these type of what I call repair, or you're trying to reframe the situation so that this is a teachable moment as opposed to a punishment, then and they feel safe in that space, then the more that they can come to you with uncomfortable situations and be able to get your advice and feel safe and feel loved in that way through action and words and affirmations, rather than what you said, right? Where they're hiding or they're doing all these things. They still might be a high performer. But can you imagine if all of those children or every child feels that way and that I mean, can you imagine all the potential that they could have and all the good that they can do? Because then also too, they become adults. If they decide to have children, right? They decide to have relationships, then they model, right? They model whoever those first people, and it could be a set, first people could be then that model for them to move forward more in a healthy way for overall health, not just mental health, but for overall health.
Absolutely. And I think that also part of it, can be overlooked is now everyone you interact with can see, how you expect to be treated by other people, where you have boundaries, right? Where you can let other people in and be vulnerable and keep yourself safe. Like all those kinds of things that are skills that we can easily go through life not learning, but are so valuable to have, not even just while you're performing, but just in general in your life, and especially, while you're performing, you're asking a lot of children, and so that pouring into them is as important as anything else, pouring into them like for who they are, right? And not just for what they're able to do.
Now, some kids won't be able to maybe say it verbally, but there are ways of doing it non-verbally, like they draw a picture, right? I mean, that's typical for some, or maybe they do a dance. I mean, there are ways, but that would require the adult to pick up on the cueing,
right.
on the
To be in
social
tune with
cueing,
them.
right? To be attuned with them, to understand that maybe what they say isn't exactly just because they're also trying to figure this whole adult world out, that they're trying to figure that then the adult can, if they have that again, that sensitivity to go, okay, they just said this, but it doesn't match up with their body. So being very immediate and intentional, like, oh, you just said that, but your body shows something else. Like, tell me about that, right? So they don't feel shame necessarily, or as opposed to like, that's stupid. No, we're going to proceed. They don't have a choice. Now, obviously, if they're in a high stress situation or they're in a danger or safety, I mean, that's when the adult definitely has to do something.
Yes.
But when it comes to something about like their feelings, opportunities, or even building it in, many organizations right now, athletic organizations, child organizations, all of those mental health components are forefront and priority. I mean, really from COVID and just a lot of celebrities who children look up to, and even child stars looking back and reflecting on their life, actually are really leading the way in other people, really anyone, to be able to speak about this. So it's it with such a mental health has always been a taboo, right? It's always been sort of a taboo, stigmatized, because it's not like an owie. It's not like a physical owie where you could see a Band-Aid or whatever. It's like it's here, and there's no necessarily script or ways to alleviate it. But I would say that it only requires one person, really. One person that believes in that child and who's consistently, and whether it's a teacher, whether it's a grandparent, whether it's a parent, whether it's a relative, whether it's a mentor, whether it's a fellow actor, a coach, you don't understand how much influence, right? Influence. And it's not unheard of where, say, for example, someone makes it big in the NFL and they shout out to their like 8th grade coach.
Yeah,
they do that. Your 8th grade, the 8th grade coach is like, if not for so-and-so, I would not be here. They do that.
It's true. And I think sometimes we look at, the children and say, I want them to be like this, and not necessarily think about what work we need to do to be that example for them, right? Like what of our own issues do we need to address before you can really fully be there for someone else, whether that's a child, whether it's a student, a student that you're coaching, all of those kinds of things. I think sometimes a lot of the pressures that are put on children are our own stuff that we haven't dealt with, maybe a dream we had that we weren't able to fulfill. Correct. And so all this pressure is being put on this child, and just taking that time to separate what belongs here, what doesn't. This is my stuff I need to deal with. This doesn't belong to this child, for example. And that can be tough to do when you're on deadline, or, someone's asking, your kid to get out there and perform. And I'm interested, because I know that you have had your child as a performer, you've been a performer yourself. What are some mistakes you've made? What's some advice that you give from your own experiences?
Well, wow, that's a great question. I'm going to start off with me. I was a ballet dancer. I also was a classically trained concert pianist. I went to college for it for a little bit. So I would say that, and I love my parents dearly, but these two like art forms were not ones that I chose. However, I did love dancing. I mean, I think if I wasn't doing this, I would have been a dancer. Like I really love dancing. I mean, all types of dance, but ballet, and I was really good at it, right? I felt really good at it. But I think the dilemma here, right? The dilemma here was how much of this as a child did I claim this as my own as I grew to know that I was good at it, and do I have a choice to continue? Okay, do I have a choice to continue? And I was doing this as an extracurricular activity, right? But I could see the dilemma really came from, it brought honor to my family that I was really good, but at the same time, what if I decide I didn't want to do this anymore, right? And that became harder, and I made those decisions when I was in college. I made those decisions because by then I was over 18. My parents heard me out. They understood like my rationale, and I had that cognitive ability to be able to say. But when I was a child, going through the lessons and things like that, and moving up the ladder to be really a performer. I mean, I performed on stage and did recitals and competitions and things like that. It was a little different because I was a child, right? I had parents. I had parents that believed in me, and I also believed. I mean, they instilled like, you are good at this.
Yes.
Right? And part of being a child is you want to feel autonomous. You want to feel like you have initiative, and you've been able, even if it was put upon you, you're like, oh, I'm going to internalize this as part of my identity now that I am a dancer. I even say that now, like, I'm a dancer. I'm a classically trained concert pianist. So with that aside, there's definitely things in every generation when you're a parent, you take the things that mean something to you and you feel like you connect with, and then you throw out some things too, right? So as a parent of 3 kids who are basically all artistic, performing arts and visual arts, the way that I see it is for us, it's like, is this something you want to do? We give them choices. Yes. Is this something that you want to pursue? We give our thoughts, whatever. Okay, so that's number 1. So they've chosen whatever they've wanted to do. Number 2, being very protective of holding on to, okay, what is typical development for your age, and what are you seeking, right? What are you seeking? So, for example, we had one child who was reading a script for a rated R movie, and the script had this child, our child, read words that were like, had cuss words, that was in an uncompromising or compromising position with an adult. And so then, as the parent, I was like, oh my gosh. And then so I asked our child, I said, okay, well, what do you think of this? Does this feel good to you? Do you even know what these words mean?
Yes.
Right? And in the end, we didn't do it because even our child's tender age, we were able to navigate, like,
that conversation.
We gave her some conversation, that we gave her some autonomy. But again, this is a very privileged standpoint, right? So choice. We also praise effort. So I always tell this story. I feel like I could potentially write a book on the psychology of the stage parent, where we were on a look-see for a modeling gig for one of our kids, and there were parents all around, and there were parents who were like screaming at their children, right? They were screaming at their children, going, if you don't get this gig, and then I don't remember what the consequence was if they didn't get the gig, right? If they didn't get the shoot, they didn't get the whatever for a high-end brand. So then I remember our child looking at me, and our child was like all of like 5 years old, and they're smart. Kids are smart.
Very smart.
Very, very smart. They can pick up your sensitivities.
Yes.
So our child was like, Mama, why is this mommy saying this? I go, okay. So this was my opportunity to teach and guide and have that positive parenting. I go, honey, you chose to do this modeling. Okay, I'm here to support you, and I'm your parent. But you go out there with that line of the panel of adults. You go out there and you just be you. You you give your best effort, be honest, and whatever you do, we love you, we care about you, we're so proud of you. Like that messaging. But again, I'm going to preface this by saying this is a privileged standpoint.
Yes.
Because when our child finally decided that, she didn't want to do this anymore, I was like, thank goodness, because it didn't fit anymore what she wanted to do.
Yes.
However, again, I'm going to say the other side where there are some kids who don't get that choice, right? They don't get that choice for whatever the reason, whether it's collectivistic families, whether you bring honor, whatever, or finances. It does, but like in our own lived experience, this is what we did. So I learned that we all children have talents and abilities, whether they're a performer, whether they're actually seen and all this stuff, they all have abilities. But the positive parenting is really important. So you could push your kid and do that, but at the end of the day, all of us, it's social psychology again, all of us want to be loved, want to feel belonging, and want to know that we have meaning and purpose in this world. And for some of us, we're in the spotlight. For some of us, we're not. Some of us, whether you're introverted, extroverted, all of those things, but that is a human condition. We all share that, whether you admit it or not. We want to feel like we belong in some sort of way, or at least have given society a purpose.
Yes.
So those are some of the things.
I think it's really helpful. I think, really good points. And, I think that you rightly acknowledged that is a privileged position. You weren't relying on your children to bring in income. And I think that can be true. And you can still bring in those elements, even if you are relying on your child, even if you really do need them to make it work. There's still ways to build a relationship with them so that when something really feels off or an adult has not been treating them right, that they can still come to you, right? It's a small example, but I think about it all the time. So, of course, you have kids. Anyone who has kids or has been around a child know that they're often like wanting to show you something. So I often hear, Mama, can I show you something? Or Mama, can I tell you something? And usually it's a fact about soccer. It's something random, that he learned at school. But I always say, you can tell me anything. I always say, you can tell me anything. And it's usually, but when it is something serious, he's heard that so many times that he doesn't think twice. He's like, of course I can tell my mom anything, And so I think like just those kind of even like little things, because the kids, they are literal. And if you say, you can tell me anything, and you listen, you look, you watch them do that soccer skill for the 1,000th time, and you're enthusiastic about it, they know, okay, this is a person who cares about me, who cares about what's important to me, who cares about how I feel. And so most of the time, I hope, God willing, it's the little things that's happening, but when it's a big thing, you built up that spirit, that kind of supportive environment with them as well. So I think all of the things that you're giving people tips about for positive parenting is valuable no matter what your child does or doesn't do.
Yeah, you're showing up. Obviously you can be disappointed with your child, and you can say that.
Yes.
You could say, I'm really disappointed by your behavior in this way. However, I'm saying these type of things, and I know it can be very uncomfortable because I love you and I care about you. And this has huge implications, I would say. And I think I sort of mentioned this, huge implications with adult relationships and friendships, and how you get along like in work teams and stuff like that later on. Because again, this is like childhood, especially the early years, like 0 to 6. Your first models for conflict resolution, engagement, feeling a sense of self, all of those type of things start in those early years. The brain, the neural connections, all of those are imprinted, so that by the time unconsciously we react to certain things or triggered. In my psychotherapy practice, I would say the number one narrative that occurs is that my parent wasn't there for me. And what they mean literally is like they were on the sidelines at a baseball or basketball team, and they're screaming like, you need to do this, you need to do that, as opposed to like just sitting there and enjoying the game and not standing out. Like, it's not about the parent, like living vicariously through their child. It's about the child and being there as like a cheerleader and an advocate for them, right? You're not the child living their life. But I think some parents, they get validation for the fact, right? Like they're tooting their child around like a trophy, going, well, my child did this and my child had that, and you're keeping up with this or whatever in those type of communities. But actually those type of things hurt. So respecting them, teaching and guiding and mentoring them, that whole adage where like, treat your child like you want to be treated. That there's a lot of these things you could correct mistakes in a loving way.
Yes. Okay, Dr.
You
Perez,
could
hold on. I want
follow
to
up
tell
and
you. I
check
want to
in.
tell you a funny story because
Yeah.
that just made me think of it.
Okay.
And
Okay.
it was such a good learning moment. It's small, but to my son, it made a big difference. So I don't know if your parents did this. My mom did this to me all the time. But like if I had something on my face, she'd just like lick her finger and clean off my face.
Oh
Like,
gosh.
it's
Yes.
I don't know if your mom did that. It's disgusting, right? I hated it. And this was maybe like a month or two ago, and Noah had something on his face, and I did the same thing. And he's like,
Right.
Mom, that's disgusting. I'm like, oh yeah, I know. I used to hate it when my mom did. And he's like, but if you hated it, why would you do that to me? And he was so
That's
like honest about like, this is not nice. Why would you do this to me? And I'm like, you're right. You're right. I'm sorry. I hated when that was done to me. And why did I just do that to you? It's just the things that you don't even think about that you're doing. But having him feel comfortable to ask me so honestly, I was like, that made me
yes.
step back a little bit. And I think that goes to what you're talking about building that kind of community. And then with your child, and then when they go out in the world, they know how to handle conflict without storming off or giving someone the silent treatment. They know how to have difficult conversations or to say that disappointed
Correct.
me, right? But it doesn't mean I'm leaving you or I'm never going to talk to you again. But that it affects them
Right.
through the rest of their lives. So I really,
Yeah.
appreciate you making that through line.
Yeah, I mean, like, this would be a whole nother conversation, but like those attachment figures, right? Our
Yeah.
attachment figures are those early years, but then it actually then affects our adult attachments, choosing partners, choosing people and friends who actually give us peace, calm our nervous system, help us emotionally regulate, but know that we love ourselves first,
Yes.
right? Because that's the goal. We love ourselves first rather than getting that outside validation. Sometimes being in performance and being on the spotlight, it's more external validation rather than sometimes working on ourselves. And so I think that all that grounding, so what I consider like grounding techniques, really, and being also like, we have two adult kids, and so our adult kids, I say to them, I'm not like micromanaging them. That's a whole different parenting style, but it's more like, I'm here if you ever want to talk,
Yes.
right? If you ever want to share, they're at that age, but we're confident that they're going to come to us and make good choices. And even if they don't make good choices or things happen to them that is not like part of our own parenting style, we're like, okay, thank you so much for telling me this. Let's work on this together. What are your thoughts, right? From a developmental point of view, once they get to be an adult, typical adult, and how they think and feel and move, that they can come up with their own problem solving skills, but giving them those opportunities. But those foundations are laid
Yes.
early on so that they can have their own self-efficacy to say, you know what, I can do some of this stuff. I can do some of this stuff, but I sometimes need a buddy
Yeah.
to guide me to do these type of things, who's an authority figure. So
Well, and I think
it's really yeah.
I think the point you made a minute ago about the validation, and it is part of the job that you want validation. It's part of all of our psyches that we want validation, right? But understanding that the external validation is fleeting, right? And doesn't mean you shouldn't achieve. It doesn't mean you shouldn't work hard. But it shouldn't be the thing that propels you forward, that helps you be a success in life. It's the validation that you give yourself about you mattering, right? And that's what parents, that's what authority figures can teach kids, is to have that within themselves, so that they can enjoy that external validation, but they're not married to it. They don't need it to survive, because just as powerful is when it's negative comments, right? We were talking about earlier on, a comment that you read about yourself. And if you've given so much weight to the positive validation, you also give so much weight to the negative kind of comments as well. And so I think just helping kids through that journey, and like helping each other through that journey, is really important.
Yeah, it's not easy, and we're all going to make mistakes. And I'm not saying you just praise your kid all the time for everything that they do. Like,
Yes.
you tie your shoe, good job. Then the weight of it and the reward, right? It's really like authentic and not fake. And a lot of parents ask me when they, consult and things like that, like, where do I go? And I know that I mentioned like the CDC and APA, American Psychological Association, but I'm also part of this coalition
Yes.
for psychology in schools and education. And so this is really for parents and for educators and really anybody. I mean, I would say arts and entertainment would benefit from this. We have this on the website, Mental Health Primer. So like kids and students experiencing stress, students
Yes.
experiencing bullying, which can happen actually with child performers and athletes.
Yes.
They're like little fact sheets. And then also through this coalition, we have these 10 principles for teaching and learning for specifically parents.
Yes.
And so those type of resources, and they're quick. They're really quick, because I know that we like those type of things, and all grounded in psychological science. So we may have common sense about some of these type of things, but we also do know that over time we have to shift our parenting to meet the needs of the generation and what makes sense, and all of the things that are trending, right? I mean, I grew up without a cell phone. So, as far as like social media and all that, I mean, if we were bullied or whatever, it's on the playground.
Yes.
But now there's just a whole bunch of other things that are happening. But I think these type of resources, especially in the psychology realm, would be beneficial for really anyone. I mean, really any industry.
I think that's great, because of course we don't want to just give people barrage of like the things to worry about and the pitfalls. We also want to tell people but this is not insurmountable, right? It requires a cultural shift. It requires like an individual shift, but it's not insurmountable, and there are resources. So those are really great,
yes,
Dr. Perez, to give people those. Okay, so our time's up, but if people want to find out more about what you're working on, get more parenting tips, like where can they get in touch with you, or where can they see what you're doing?
So I'm on LinkedIn, so it's Patricia H.A. Perez, PhD, and I'm also on Instagram. It's dr.Patricia Perez. So those are the two places that you could find me. But this has been a pleasure. Thank you so much for this invitation. I hope it was helpful in some sort of way, and congratulations on your podcast.
Thank you. No, this was wonderful. Really helpful, Dr. Perez. I think real life accessible tips that people can have no matter what your child is doing, no matter, if they're performing, if they're getting through their day-to-day life, not on a stage. It's still all really valuable. So thank you so much for sharing.
Thank you.
Thank you for joining. To find out more about what I'm working on, you can visit my website, drpatricelegoy.com, or you can visit me on Instagram at therapy_with_Dr_Patrice. Thank you so much.